Ladies and gentlemen, that's the point. Our discussion about Devi's horror is incomplete if we do not reflect upon how it has reverberated across the country. Delhi, Mumbai, Bangalore, Pune, Chandigarh, Lucknow, many cities saw doctors and medical staff in their white coats hit the streets demanding one basic right, the right to be safe at work. After all, hospitals and clinics are workplaces, but they are workplaces with a difference. They are workplaces where you don't have to establish your identity or do a biometric to enter. All sorts of people are constantly entering and exiting. You have patients, you have doctors, you have touts, you have all kinds of people. You simply cannot control that. So what becomes imperative is that there is ample security to secure people who work in hospitals. Doctors, nurses, support staff, more. But violence against doctors, unfortunately, is a worldwide phenomena that only seems to be growing. The World Health Organization says that 8 to 38% of health workers have suffered physical violence at some point in their careers. According to a TOI report, the percentage of doctors who have experienced violence in workplaces was highest in China at 85%, 75% in India, 75%, and 47% in the US. Not very surprisingly, the attackers were mostly patients or their relatives. In fact, there has been a significant rise in these attacks since the pandemic happened. Remember the time when frontline workers were trying to save lives and instead they were chased, hit by stones, stabbed, slapped, whatnot. The spurt in such incidents had sparked enough concern for a law in India to come into existence. But that law is very weak. It said that a person who attacked a doctor can get a jail term of up to 3 years and a fine of 50,000 rupees. Not very surprisingly, several cases have surfaced after that. A few months ago, if you remember, a man struck a doctor 18 times with a sickle. In May 2023, a young 26-year-old female doctor, Vandana Das, was stabbed to death at a hospital in Kollam, in Kerala, by a patient. How can we forget what happened at the Maulana Azad Medical College here in Delhi? It was a rape that shook the nation in 2002. This is when a resident doctor was raped by 2 men on knife point in broad daylight. Even 22 years later, the parallels with what has happened in RG Kar are chilling. Cut to 2024, looks like nothing has changed. How do we protect those who have dedicated their entire lives to protecting us is a question I'm asking doctors who are joining us this evening, just doctors. Dr. Sanjeev Bagai continues to be with us. Dr. Suneela Garg is the chair of the Program Advisory Committee. Dr. Shazia Zaidi is from the Lal Bahadur Shastri Government Hospital in Delhi. She's an ex-resident there. Dr. Swati Maheshwari is a senior internal medicine expert. She's joining us as well. Dr. Suneela Garg, you remember what had happened in Mamsi at the Maulana Azad Medical College some 20 years ago. When I see what has happened at RG Kar in Calcutta, I think to myself, my God, has nothing changed? That happened in broad daylight. This happened in the dead of the night.
Yeah, Shreya, thank you for having me on the show. I think I'll say that it is the most horrifying period of our life, and I think it was a kind of a coincidence that I went for attending the conference during the same time in Kolkata, and when I came back to Delhi, I heard about this incident. It really shook me from top to down. But I will say one word, that looking between 3 to 5, this is my own thing. It is not a job of a single person. Now, coming back to your question, so we need to investigate it immediately without losing precious time, and we need to kind of see that, the case needs to be investigated thoroughly, because if we talk of multiple injuries, we talk of rape, we talk of no voice, you see, and we talk of a seminar room where outside nobody is there. You see, that is one thing which is very strange. But then, we need to have it. It's not only the fault of, I'll say that systems, but it is overall fault of, I'll say that, that hospitals have become so vulnerable. So that's where we need to really look at, the Clinical Establishment Act, rule number 220, where, it was put in the parliament about, healthcare safety or safety of the healthcare professionals. So, after that, how much have we moved? Have we moved our workplaces safer for our healthcare professionals? Does everyone have an easy access, whether we talk of contractual staff? Who are they? Whether they belong to police, whether they belong to healthcare sector, whether they belong to administrative. Does anybody have got power to, walk in easily? Can you walk into a, administrative officer's room or an IAS officer that very easily? You have to cross 4 or 5 barriers. Why, these places are made an easy place to access? Why in the era of digital technology there are no digital cards so that one can access easily? One cannot access easily. That is one thing which is very important. Second is, after this, why, the SOPs are not in place? That is police verification of everyone and timely verification. That is another thing which I would like to say. And the third part is that doctors on duty, are they being watched? That means not only watching for what they are doing, but exactly are they safe or not? Where are they? This girl had her dinner at 2 o'clock in night and with her young colleagues. After that, what happened to her? You just can't lose a track of her. And she is not, let me tell you, she's a qualified second year postgraduate and doing her duties in chest medicine, which is very difficult to get. That is one thing which we all have to remember. So she's a bright girl, which we have to remember. Then another thing is that, 36 hours of duty. Where are regulated duty hours? We are supposed to put them on duty for 8 to 10 hours. And I will also say that here comes, our role and responsibility, not only as doctors, but as, from part of National Medical Commission, when we do the inspections of these medical colleges and all that, do we make sure that they have regulated hours, number one? Number two, do they have ensured safety of the healthcare professionals? Do doctors have duty room to themselves? And in middle of the night, are they having access to tea, coffee or food and all that? Or do they have go out somewhere, to have, food which is not safe? So we need to see that whether police is round the clock and they're doing their job. So I feel all these things need to be taken into consideration. But this is a very, very, serious matter which needs to be acted upon within 24 hours. We need to act upon it.
No, you know what the problem is? No, you know what the problem is, Dr. Garg. Today we are talking about it. Tomorrow we'll talk about it. On day 4, governments will come and say, okay, now as a rule, SOP, inspection of all hospitals, whether CCTVs are there, whether security is there. ये पूरी कहानी 4-5 दिन चलेगी, maybe 1 week. After that, everyone will forget till something like this happens again. Dr. Shazia Zaidi, are you a bit surprised that the young doctor, we are just calling her Devi because we do not know how to address her, so we are just calling her Devi, that Devi was alone in the middle of the night. She was the doctor on duty and she was absolutely alone because 2 of her colleagues, I'm fairly certain if the 3 were together, if the 3 doctors were together, something like this would not have happened. But the other 2 went away to their rooms and she continued to be alone. I want to ask you whether this is regular practice, whether this happens.
Yeah, exactly. Yeah, so I just want to tell you what exactly happens in a government medical college and what is actually the environment going on in a government hospital where we worked as resident doctors. I'll start with the basic point. The basic problem is that the doctor-patient ratio is pathetic. It is that pathetic that every resident doctor, be it any specialty, any branch, is overworked. Overworked to the limit that, they don't have the time for meals, they don't have the time to go to washrooms. That is during the normal day hours. Now coming to these night and these 24 and 48 and 36 hours. Now, just like somebody was speaking before, the duty hours are pathetically regulated. The resident, these young doctors, they have 24 hours, 48 hours, 36 hours repeatedly. There were times, that, we would just not even remember that, we have to even go to the washroom to take a bath. These were the conditions. Now, with these things, we have never seen doctors complaining that, these are the problems. But now when safety is compromised, now that is a big problem, because these junior doctors are who? They are MBBS pass outs. We are all MBBS pass outs from the age of 25 to roughly 32 years of age. Now, if we, in the departments of gynecology and anesthesiology, we have night hours, we have 24, 36 hours. So what are the basic things that we need is guards, because these are public places. These are government public places. Anybody is coming in, anybody is going out. So guards, that is such a basic necessity, which was always short. I mean, we used to talk about it even during our duties that we are not feeling safe. Something can happen, some mishap can happen. We always used to wait, yeah, ki theek hai, nahi hua hai, so there is nothing that you can really do about it. But now when such incidents are actually happening, if now also we do not look at these problems, that these things need to be addressed, it's going to become very, very problematic.
Dr. Zaidi, here's what I'll say. You're much younger than me. But here in Delhi, at the Maulana Azad Medical College, there was a resident doctor who was raped at knife point in broad daylight. And that is when, 20 years ago, all these questions had arisen. And that is when all sorts of safety protocols in government hospitals were put in place. But look at where those protocols have gone over the last 20 years. Dr. Maheshwari, you're a senior internal medicine expert. My question is, if doctors are not feeling safe in their workplaces, all of us, it's what we deserve, right? That if I come to the Times Network, I feel safe here. This is my workplace. This is my safe zone. I feel safe here, which is why I give it my best. What do you see have been the failures of not just this Kolkata government hospital, but government hospitals across India, and whether you think this is a problem only with government hospitals and not private hospitals?
I agree with you, Shreya. We consider our workplace a second home, and so definitely we want to feel as safe as at home. So be it at the workplace as well. But the harsh reality in India is that the doctor's life is very cheap. And that is what we are seeing today as well. Despite the repeated calls for, having more stringent laws to protect the doctors, despite the advocacy, to have a better workplace safety measures, what we see today is the systems are stretched thin. The system is overburdened. The workplace safety measures are completely overlooked. That's what we see. And that's why, at present state, this is what is coming out, that the doctors are sitting there and protesting on the strike, saying that we need these basic needs of, to work in a place, and that is what is required. I don't think this is such a big demand as such, if you look at it, because what we are asking is that where we work, we should be safe. We should have proper lighting in the hospitals. We should have proper security personnel. We should have CCTVs. We should have places where we can sit and work in a very conducive environment. And what's wrong in that and asking that? And I don't think it's such a big demand. But whatever existing laws we have as of now, Shreya, enforcement is a big problem. Even if you look at Nirbhaya case, where, we were expecting fast track, conviction trials and all those, it took good 7 years to, deliver that result. And now we are again sitting on a similar kind of a case. Again, we are expecting fast track judicial system. We are expecting the systems to wake up, but it doesn't look like the system is waking up at all. And like you said, again, this will go under the carpet. Again, this will be forgotten until we find another case like this, until, it kind of puts us out back into this arena again. I think it is really time that the government should think about this Central Protection Act, because even if you look at the studies now, even the general says that 75% of the doctors in India face some kind of violence in their lifetime. So it's not a small amount. That's what I would try to say. Every doctor feels threatened. If he feels vulnerable at his workplace, and that is something which is so much more essential to understand, that the doctor who's working in under pressure circumstances, who's working all the time, 48, 72 hours, what they're asking is just that you give us a safe place to work. And I think, now the health ministers, the state ministers, everybody, we need a concerted effort, because what happens is states, they take on to a different, kind of laws. The central government is on a different platform, and therefore we do not see a uniformed act coming out, which is, completely active in entire India. So, every state is working on their own parallels, and that is why we don't see a concerted effort, which is definitely required right now.
Okay, Dr. Sanjeev Bagai, I was, just showing our viewers pictures of young resident doctors with candles, sitting on protest with posters. Took me back 20 years, because the girl who was raped, the resident doctor who was raped, was a batchmate of my cousin. And all of us knew what had happened. It happened in broad daylight. This happened in the dead of the night. And when I look at these pictures, I'm taken back 20 years. And I with a certain degree of certainty can say that in the last 20 years, the system has been asleep. It woke up for probably 5 minutes, and then like Kumbhkarn, it went back to sleep again till it was jolted on Thursday night. Is it a problem with the law because the law clearly is weak? Or is there a larger problem which gets sidetracked after the immediate aftermath of what has happened in Kolkata?
Okay, sure. So let me address this in a systematic manner. I think the number of doctors is less. The duty hours are too long. It's inhuman to make doctors work for that long. Your judgment and your clinical skills diminish with such long hours. The number of patients which each doctor sees as a trainee or a resident doctor is much more than probably what a Western country doctor would see in a month, we see in a day. It takes a toll psychologically, mentally. There is no other line which is more physically, mentally, emotionally challenging than doing medicine in India. Very often we see a finished product as a senior consultant or doctors who are entrepreneurs and running large establishments. But let's not forget what we've gone through. It's like going through a furnace for good 12 to 15 years to reach this level. Long hours, extremely strenuous circumstances. It's very difficult to deal with patients who are coming in critical needs in the emergency room, in the operation theaters, in the ICUs, taking ward rounds, writing your thesis, reading long hours, come to the hospital. It's a systematic failure of system and processes in this hospital. There is no doubt that security was perhaps nil. There is no screening of these so-called contractual people. There is no business for this goon to be entering at 4 a.m. in the morning as a contractual staff. There should be an access card. Even hospitals nowadays, as medical staff, if you're not supposed to be in that restricted area, your access card denies you access in going into restricted areas. So we need to use technology. It's not that expensive. It's just common sense. There is no proper security guards on each floor. There are no lady security guards. When you know the females, especially in OBGYN and in pediatrics and ophthal, when we are doing night duties, there will be a given number of female residents. We need to make sure there is clean drinking water for these poor kids. We need to make sure food is given to them. Accommodation, there should be a doctor call room. There has to be a guard there. We need CCTV cameras, yes, for sure. There is a proper security protocol to protect the physical and mental interests. Any physical, mental, or sexual harm,
that
even
nothing existed in KG. Right. Dr. Bagai, I'm just stunned. This is basic SOP, standard operating procedure that you're talking about, and none of it existed at the RG Kar hospital. So this is a failure at multiple levels, not just the Calcutta police, the hospital as well. And the problem is that the person under whose watch this has happened has actually been rewarded. Yeah, he resigned and then he was rehabilitated within 72 hours at another medical college. So what is the message that the state government is trying to send? Hamari galti nahi hai. Ho gaya, lekin hamari galti nahi hai. Dr. Bagai, I'm afraid I'll have to end it here. I've completely run out of time. Thank you very much for joining us, though. Dr. Garg, thank you very much. Dr. Shazia Zaidi, thank you very much. And thank you to Dr. Swati Maheshwari, who joined us on this debate as well. Ladies and gentlemen, the hope, the perennial hope, always is that maybe after this, something will change at government hospitals. Will it? We'll just wait and watch.